So, you know, you mentioned that Lewis Sullivan was one of those folks in Atlanta who received the vaccine. And so Dr. Sullivan,
Right.
a hematologist, oncologist like you, pioneer in medicine, African-American physician, was the Secretary
Right.
of Health and Human Services
right.
in the George H.W. Bush administration. And I think the first African-American to hold that role. Prior to that, was already the first president at Morehouse School of Medicine, and he went back to that role after his term at HHS. And as a 90-year-old man,
That's right.
he was there to get that vaccine. And
That's
he is
right.
clearly a national, international leader, and he stood up to do it. And I think that speaks volumes.
Absolutely.
So, as we mentioned that, you know, we are as a group people of color, because quite frankly now the data coming out on Latinx population, particularly we're hearing from Texas and California, is actually perhaps in some cases more sobering what we're hearing from African Americans, in that they are in some cases 3 and 4 times more likely to die from COVID infection than whites in those areas. But so people of color and poor people are at higher risk.
Right.
We heard all these reasons, all the comorbidities, and we'll talk a bit about that in a second. You can't isolate from anyone.
Right.
Are more likely to work in essential jobs. And,
Exactly.
you know, and the essential job is not like being the president of the United States or a physician. The essential job is the person who gets you your food in the grocery store,
right.
in a restaurant or fast food restaurant, the person who cleans up.
That's right.
Right? And quite frankly, those are the people we'll miss first.
Exactly.
If they were not be on the job.
We would.
And so, and then within the population we have, as I said, these comorbid conditions like diabetes and high blood pressure and hypertension, kidney disease and stroke. And so one of the things about this pandemic is that people have become concerned about getting out, period, and that includes getting out to see their physician. So we have a group of people who've already concerned, a little hesitant sometimes about getting health care.
That's right.
And now they have another reason to not maybe go out to a doctor's office where sick people might be. And then their chronic conditions start to get worse.
Exactly.
So it's incredibly important that we make sure that we still pay attention to health care.
Absolutely.
And get that, so that, because the data does show that if your comorbid conditions, your diabetes, your high blood pressure are controlled,
Right.
the likelihood of having a bad outcome from COVID goes way, way down.
Right.
Now you take care of a really high risk group of
That's right. Whose immune
patients.
systems are compromised due to cancer, due to sickle cell or other blood conditions. So it is imperative that they come in for their treatments, and we're taking special precautions. You know, we are screening at the door, and if you have fever or symptoms, you're taken to this area, not mixed in with people. We're doing the social distancing in the waiting rooms. We're wearing the mask. So those things are important. And I must say that even though you and I have been vaccinated, we still have to be vigilant.
Absolutely.
We're still wearing the mask because we don't know. There's some talk about you could still maybe transmit it to someone else, even though you may not get sick.
Right.
So we still have to do the things that we know have worked.
Absolutely.
And that's wearing the mask, staying 6 feet apart, not attending social gatherings. Those are important things. But I want to make a point too, because as I have talked to some people who didn't have diabetes or high blood pressure or asthma, they weren't aware that they had a comorbidity and what that means. And so I just want to break it down and say, if you take medicine or a treatment by mouth, in a shot, or an inhaler, you have a comorbidity. You have a condition that may make it more difficult for you to recover from COVID-19.
That's right. That's right. And, it's interesting, particularly in most all of our communities, but we make a point of it in our community about listening to elders.
Right.
And I noticed that now that we've opened up to the 75 and over, we don't seem to have any problems with them.
Right.
When their willingness to get the vaccine, and the key is just having enough vaccine for them.
Right.
And this is a group of people who actually may have been around in many cases when Tuskegee experiment was ongoing.
That's right.
And saw many other atrocities happen
Yes.
during their life. But they see this, they have taken in the data, made that decision,
That's
and
right.
they want it.
Yes.
They want it.
They're becoming our public health advocates.
Exactly. And I think their children and grandchildren and great-grands and great-greats, if they have them, should follow suit.
That's right.
Will you talk a bit about the vaccine in children? Because we're talking about giving it to adults, and we haven't really talked about kids here.
Right, and that's part of the safety procedures we do for clinical trials when new things come out. So for the Pfizer vaccine, it was initially administered to 16 years of age and older. Actually, the 16-year-olds were added later. It was
Okay.
18 and older. And then the 16-year-olds were added. The Moderna, I'm told, was 18. So we don't have the safety information or the effectiveness in younger children. The trials are down to age 12. So it's going to be in a stepwise fashion. So we typically look at what happens to adults first before we do children.
Right.
But of course, there are childhood cancers, for instance, that adults don't get. So there are clinical trials that are done in children first when necessary. And we also know that children are not just smaller versions of adults.
Right.
We handle drugs differently. We respond to diseases differently. So the studies need to be done for it to be safe and effective in children. We'll get there, but that's the part of the research that takes time.
Right.
So again, stressing, we haven't skipped any steps. But children, are not getting as much press about having COVID-19, but they do get COVID-19, and some of them get very sick.
Right.
Especially children who have these comorbidities that, we're talking about.
Right.
So it is important to note that, because some people are thinking children don't get it.
Right. One of the things that comes up as a concern about the vaccine is it going to be like the flu vaccine?
Right.
So most people, quite frankly, don't remember all the vaccines they got in childhood. We get them so early, you don't have memory of those things. But the flu vaccine, because we do it yearly, you do remember. And
Right.
there's always a good bit of apprehension. We hear about it only being partly effective.
Right. Or I got the flu
I
and
got
got
the
real
flu.
sick, and that was the only time I ever got it.
Exactly. And so, and then there's the question, like, we have to take it, but we don't, it's not a demand requirement for our job that we take COVID vaccine at the moment.
Right.
So the flu vaccine has to be done every year because the virus has this amazing ability to shift and drift, as
Right.
they call it, and basically be a new active form every year. And our scientists make the best guess they are able to make
Right.
as to what the predominant strains will be. So right now we're in winter and it's summer down in South America. When we were in summer, it was winter in South
Right.
America. And what was happening with flu in South America then was going to help us predict what would happen with flu with us here. And they based the vaccines on that. But you don't always get it fully right.
Right.
But what we do know that if those people who get the vaccine, even if they get the flu, they're
Right.
less likely to get the severe form of flu that really puts them in the hospital
That's
for
right.
a long period of time. This virus, we don't yet know what it's going to do.
Right. Right.
We may turn out that we have to get that vaccine every year.
It may be. It may be that. And we're already seeing that the virus can mutate.
Yes.
because we have some different strains out there
Right.
now.
Yeah.
Yeah.
Unfortunately, at least the strains that have been identified are still covered by the
Still
virus,
covered.
by the vaccine, I'm sorry.
Right.
However, there is some concern if we don't get people vaccinated
Right.
and circulates more, we will get a mutated strain that isn't covered. So the importance of getting protection amongst the entire community
Right.
is very, very important right now.